Yes, yes, yes. Welcome to another episode of Hip Hope Hooray, Men Talking Health. I am your MC for this evening. I am Oya Gilbert, and we have a really dope program for you today. In the building, I got this guy and that guy, some of my constituents from the myeloma community, and we're excited to be here today to share their stories and talk about myeloma and some of the challenges that we face. Now, the key is this gentleman here has myeloma, and this gentleman is a care partner, which is something that's kind of unique in this world today. Typically, we always like it's normally a female, but today we have a male care partner in the building to share his journey and his vision on taking care of his patient, which is, let me not spoil it for everything. Let them tell their own story, and I'll start by letting my man to the left introduce himself. And
my name is Chad Moore. I'm originally from Decatur, Illinois, but currently living in Bloomington, Illinois.
Okay.
And I'm, like my friend Oya said, I'm a care partner for my wife, Adrian.
Adrian, and she do get the same last name as you, right?
Yep. This wife does, yeah. This wife got it.
And to my right,
Hey, great day, everyone. I'm Richard Armstrong, and I'm from Philadelphia, Pennsylvania. Multiple myeloma patient. I was diagnosed in May of 2021. And so I'm so glad to be here with Chad and Oya, and I'm looking forward to a great session.
so we got Rich, I got Chad. Chad is he's not technically from Chi-Town, but he's pretty close. One of my favorite basketball teams, and of course, the Philly, some Eagle people up there, you know what I'm saying? We
Gotta
got Rich
do
in
it,
the
man.
building.
Gotta do it.
So-
E-A-G-L-E-S.
So as you well know, I am a multiple myeloma patient of 7.5 years. So I wanted to kind of really just touch on explaining what the disease is. And I think I'll start, with that. Myeloma is a cancer of the bone marrow, of the, I would say, plasma cells in the bone marrow, sorry. And what it does cause is deterioration of the bones over the course of time, and that leads to tremendous back pain, as we'll get into, fractures, things of that nature. Kidney failure is another side effect of multiple myeloma, but it's incurable. However, it is extremely treatable in today's times, as you will hear and discuss. As you can see, not this guy, but his wife is in the background. And we're all living great lives. We're all living great lives. So I want to start with you, Rich, so you can share your myeloma journey and explain to the people how you were diagnosed and how you got here.
So, diagnosed in May of 2021, height of the pandemic, and it was a little bit of a difficult time. It was hard to get medical treatment, and so my primary had stopped practicing. A lot of the doctors had stopped practicing, and so I was having increasing pain. And so 30 years ago, I was involved in a rear-end automobile accident, and I had body cast and injections in my spine. And so, I thought, like, okay, I'm getting to 60, and I'm supposed to sort of feel this way, and the symptoms just kept progressing. And so it started with back pain, and just it became more and more unusual to the point where I just, I was having just tremors and spasms, and the spasms got so bad that I was literally like, I couldn't talk, I couldn't swallow, and it was just the spasms in my back going into my neck and the whole thing. And then simultaneously, I started having, and I did not realize at the time, but I started having symptoms involving my kidneys. And I thought that it was kind of nerve compression from my back. And so I always, as I tell my story, don't play doctor. If you're not feeling well, go to a doctor. Because I assumed that all of the symptoms that I was feeling were coming from these injuries 30 years ago. And so it got to the point where a few months in, maybe around, so I started feeling it around October, November. And I remember that there was a snowstorm, and my brother-in-law, we were out and we were shoveling. And I took like 2 shovels full. And I told my brother-in-law, I said, like, I have to sit down. I've got to sit down. I was so out of breath. Now, this is unlike me. I'm normally in great shape. And so this was really, really bizarre. And on top of the back pain, I just had this terrible feeling. So finally I was able to, so I thought to myself, and again, playing doctor, I said, well, maybe if I go to a chiropractor and get an adjustment, like this will help to get me out of pain. And, and I attributed out of breath to, I had a case of COVID before anyone knew what COVID was. And so I'd gone to Las Vegas and came back and, was coughing and all of this other stuff. And it was crazy. It was, more than anything that I had ever felt. And a couple of weeks later, I started reading about, the Pacific Northwest and people presenting with these symptoms of COVID. Right. And I said, oh my God, I almost had that and almost died from it. And so it was the perfect storm of stuff. And so I went to the pain clinic. Pain clinic did imaging of my spine. And they said, oh, we see some kind of funny stuff and crazy. And I said, well, no, 30 years ago I was in body casting it. And the doctor, who was an anesthesiologist, said, well, no, this looks like can, and stopped right there.
He said it looks like,
can.
And break that down.
So he realized that as an anesthesiologist, he couldn't say it was cancer. He didn't want to diagnose me based on an image. And so literally, my eyes perked up and I said, okay, well, what do I need to do? And so he said, okay, well, we're going to do this imaging of your abdomen and your chest. At that point, they thought I had metastatic cancer, because the lesions in my spine, from my skull all the way down, to my tailbone, were really significant. And that's what was causing the pain. That was what was causing the muscle spasms.
It sounds like, listening to you, I can understand why you were in so much pain, because you had lesions all along your spine, which is another common side effect that goes along with multiple myeloma, especially in the latter part of its stages. We classify it in different, you got MGUS, you got smoldering and all those different things. But when I was diagnosed, it was like 1, 2, 3, stages 1, 2, and 3.
Yes.
I would assume you were in obviously stage 3.
Stage 3.
And you're suffering, and you're suffering from renal kidney failure, or almost?
Which I did not know.
Okay.
And so that was the other part of it. And so I kind of, because I was sort of playing doctor, I didn't really report the symptoms that I was having that ultimately were symptoms of kidney failure. And so, it started with me not being able to hold my urine. And this got increasingly worse. And it was very subtle at first, but then it got to the point where I didn't want to leave the house. Like literally, if I left the house, I knew I was going to have to go to the bathroom. And I can remember so many times when, I'm trying to find a bathroom. And going to a Home Depot or a Lowe's and trying to figure out where the bathroom was, and I have to say, with all seriousness, there was a couple of times when I didn't make it. I'm at the edge of the door and I just couldn't hold it, and there it goes, and I'm looking around.
Right.
And,
that ain't the best of moments.
No, it was it was a low moment, and so but I had it's very subtle swelling of my ankles. All of this sort of symptoms, and I'll say this that's very important. Late diagnosis in multiple myeloma is a very, very common thing, but it's a very, very tragic thing, because once you're symptomatic, that means that you're having damage to your bones. That means you're having damage to your kidneys, and much of this damage is irreversible. Yeah. And so for me, when I was diagnosed, so going back to playing find the can. So they said, okay, we're going to schedule these imaging to find out what cancer you have and where it is. And so that morning, I had finally was able to do my blood work, get my blood work drawn, and then I was going to play find a can. I was going to go get my imaging done, which is at another center. Get my blood work drawn, and literally, as I'm driving over to play find a can to get my imaging done, my doctor calls me frantic. Rich, you have got to go to the hospital. And so again, I'm thinking, well, it took me almost a month to get an insurance approval and get this imaging scheduled, like I need to do this. And she's like, no, you don't understand. Your numbers just came back from the lab. You need to go to the hospital now. Whatever you're doing, stop it.
So from that point, you went straight to the emergency room.
Straight to the emergency room.
And once you got into the emergency room, kind of just briefly explain how did that diagnosis portion just come about? Because it sounds like it wasn't something that was a lengthy process like for mine, but it was super delayed. And I got a really bizarre story, but explain, like, you're in the hospital, you know what's happening as far as your numbers and everything. So how did they get to that space of diagnosing you?
Well, I get to the hospital, it's a zoo, height of COVID, people coughing, and this is my worst nightmare because I had been avoiding going to the hospital because I did not want to get COVID. They punched my name in and they saw my numbers and they said, no, you've got to come back now. So I spent 3 days, literally 3 days in the emergency room triage because there was no rooms upstairs in the hospital to treat me. So by the second day, now clearly they knew that my kidneys were failing. I'm at 9% kidney function. And literally, it's the race to save my life. So I'm 3 days and I'm circling the drain. They're trying to get my kidneys restarted. And as it turns out, they told me in the emergency room, they said, we're 99% sure you have multiple myeloma. This was maybe about 48 hours in before they had taken me upstairs. They said, but we got to do a bone marrow biopsy to confirm this. And once they did the bone marrow biopsy and then some of the other tests, they knew to do the real specific myeloma test. As it turns out, and I always tell this fun fact. So a human being who's normal, no infection, light chains is a protein that occurs in your body and it's related to the amount of infection that you have in your system. Normal human being, light chains between 3 and 19. When I was diagnosed, my light chains were over 43,000.
Wow, that's crazy work. So first of all, you tell a story like it has all the details. You know what I mean? Like there's no room for misinterpreting what's going on. And for your light chains to be that high, you're lucky to even at that moment, because that is definitely put you in a position of your kidneys completely failed. I know you had to have some kind of care partner in your life, and I'm gonna transition over to my man Chad, the importance of having a care. I want you to stress briefly the importance of a care partner, and then I want to hear from a care partner.
Yeah, so I'll say that, so at that time, my biggest care partners were my family. My mother and my sister were the ones that really made sure that everything was good in terms of, advocating for me, making sure that I had, all the food, keeping my spirits high. And I had a ton of friends and family that just prayed for me, and so that was amazing.
And that's not always the case.
No.
So that's a blessing, right? Just in general, because it's not always the case to have so much of a big support system, or sometimes we don't even recognize that we have a support system because we're not leaning into them. We either don't want their help, or we feel like we're bothering people and things of that nature. And I always try to say, hey, don't block nobody's blessings.
No.
If somebody wants to, especially in today's time, nobody ain't trying to give out nothing free. Only thing you think you can get free in America today is probably a behind whipping. You know what I'm saying? But the point is, if you want that, if you do not try to impede people trying to offer their help. So Chad, you have a different perspective that I wanted to bring to the show because you're a care partner.
Yes.
So I wanted to hear take me back to the time where your wife was before diagnosis.
Man, I'm gonna take you back even before that. Like, I'm gonna take you way back. We're going back to 1995.
Oh, Lord.
I'm gonna take you back. That's whenever I met her.
The archives.
So
We're
we've
going
been
to the
partners.
archives.
We've been
I felt like
partners.
this was a rap song that was about this. Let me take you way back.
I wish. No, but so we went way back. We've been partners for a long time. Like we had a child when we were children. Then I made a major decision, joined the United States Marine Corps. She followed me, was there with me, left her.
Thank you for your service, man.
It was a pleasure. It was a pleasure. She was there. We had our kids together, and she's just been my rock like the entire time. So, and she's always been she's like a rock that's wrapped in leather. She's got this. She's tough too. She's tough.
That's dope. I like that.
Yeah.
I gotta use that one. Rock wrapped in leather.
So she's always doing things. She's always been in motion. She's always been a person that's about accomplishing things. So she's experienced some body pain, you know, as patients do whenever they be in even their initial stage of having multiple myeloma. And our entire family had shared a physician. So this was a doctor that we all trusted deeply, and he was a great doctor. Whenever we went in there, he would sit and talk to us for 45 minutes or an hour at a time, all of us. He would ask me about her and the kids.
Where you live at?
Yeah, right.
Yeah.
It's a town. It's about 80,000 people that live where we're from. So, but he would ask us about our kids in our appointments. Ask them about us. I played baseball. He would ask them, "Is your dad playing baseball?
Right.
How's his arm?" All this other stuff. So, we had a really good relationship with him. So whenever she would go to him and say, you know, I've got back pain, and he went through the list of things that it could be. It's just multiple myeloma was so far down on the list that
it might not have been on it.
Right.
to be
Yeah.
honest.
Oh, it definitely wasn't on the list. Like nowhere near the list. So he sent her to the chiropractor. He sent her, they've been her in all kinds of different directions to straighten her out. Physical therapy, that didn't work. Spent a couple of evenings in the emergency room, and finally she couldn't walk, basically. Her lower body ceased functioning. So, and it was in October of 2020. So again, it was like the height of COVID. So I had to call the ambulance to come to the house. And at the time, I just knew she was sick. And so I had to tell them, I know there's this thing that's going around and she hasn't been tested for it. So I don't know if she's got it. So they had to test her for that. Luckily it came back negative. So they had to keep us separated even for a portion after she got to the hospital.
So this is them testing her for COVID.
This is COVID, and I'm sorry, I did get out of sorts because this is actually the second trip to the ER that we had made. So that portion, for that particular trip, after they cleared her of COVID and they let me go back to see her, they gave her some pain medicine intravenously and told her that she could have a lidocaine patch, I think. Told us to stop and get lidocaine patches. So we did that, sent her home. Then finally the next time when I had to take her to the emergency room, that time her back had completely broken.
Oh, Jesus.
And
so all the visits all our emergency room visits were due to severe back pain, correct?
Yes.
Okay.
Yes,
severe pain.
It was all severe back pain, and at the time we had been doing a bunch of work in our yard. She'd been moving bricks, so all right, I said rock wrapped in leather, right?
Y'all don't know his wife. I mean, right. I know her. I see her, and I'm just thinking about her moving, bricks around. Don't worry about it. Go ahead, Chad. My fault. It was just a moment I had, and I didn't mean to light it.
It's true. With a broken back.
Right.
With a broken back.
But that sounds just like her.
Right? And she didn't even ask for help. It was like, so we get to the emergency room. They still don't know what's wrong with her. They just know she's got back pain. They see a 42-year-old young woman 3 kids, like she's active. They asked
Definitely not multiple myeloma.
Right. No, obviously not. What are you eating? She's very intentional about what at the time about what she was putting into her body because she was eating a keto diet.
Okay.
So
describe that because I'm a little uneducated. What's a keto diet?
Keto diet, from the way I understand it, the way it was forced down my throat, is it's no fun. There's no carbs, no potatoes, no chocolate, no soda. Right? It's red meat, basically, which is good, chicken. But it was an easy diagnosis for the emergency room doctors to say, you need to alter your diet because you're not digesting your food good enough.
Okay.
So and she was in so much pain, and this woman she is so tough. She's crying, and I'm talking to the doctors, and I'm like, she's got a really high pain tolerance. Like,
right. But this is ridiculous.
Like, there's something wrong here.
Right.
So, and finally, she was able. There was a change in shift while we were there, and she was able to talk one of the nurses into advocating to get her a CT scan. So they did that, and they read it, and everything looked great.
Right.
So they sent us home, and called like an hour and a half later and said, you need to come back to the emergency room immediately. So we drove in there, and they were waiting in the parking lot with a wheelchair, wheeled us into a little gray room,
right.
No pictures on the walls. And,
that sounds like a padded room.
right?
Yeah.
They're like,
wait here.
No, they didn't leave us once we got in there. Like he came in, he felt horrible because whenever they initially, whoever had read it initially, I guess was maybe the radiologist, or maybe not the radiologist, I'm not sure. But
right.
By the time the person read it that knew what to look for, they saw that there was something drastically wrong. And, he said, you look like you've been shot at point blank range by a small caliber rifle because her spine had shattered.
Right.
So he said, you didn't fall or have an accident, so there was no traumatic thing. So this is probably caused by an illness, most likely leukemia, ding, 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 I know what that is, right. Or multiple myeloma.
Right.
Skin cancer?
Right, that's what most
right.
people, melanoma,
which is not.
But
not.
It is definitely not the same.
No, and it was, from that point in time, she didn't leave the hospital. She had to have her back stabilized because it was.
How long was the time frame from, I guess, because it sounds like she was having some pain in general that we could maybe just attest to just life, because she was lifting bricks and heavy stone and building pyramids and stuff. Yeah. But I'm just saying, like,
that's her.
Where was the time frame? How long till that point of being in the hospital and they saying, this might be leukemia or multiple? Was it a year?
Oh, from the first back pain, I mean, it was a solid year, okay. I would say, because she had back pain for just. It had progressively gotten worse. She had back pain where it seemed like the kind of back pain that everybody our age had. But then, she's laying in bed at 10 o'clock crying, and that's just not the kind of back pain that I was having.
Yeah, so. and the reason why I asked is because I was sitting here thinking about when you look across this landscape right here on the stage and think about how things are delayed diagnosed, typically, especially in the Black community and Black and brown community. And I was listening to your story and saying, what's crazy is, even though you had this wonderful doctor that, I actually would like to know who this guy is. That's typically not a normal experience dealing with a physician, that level of time spent. That's what a doctor's supposed to be doing.
Right.
What happened to you guys? And I was sitting over here in dreamland, like, wow, that's dope. However, even though you had that relationship with him, you still were misdiagnosed to a dynamic where once again, recognizing, just looking at her age, just who she is and what she does, to just not even be thinking about cancer. It's got to be something regular. So that's what I was trying to grasp, the importance of.
It was almost like they almost wanted to kind of blame her
Correct.
and
That's
her
what it sounded
lifestyle, as opposed to, you know.
And that's what that's what they did in my particular case, where when I went to the doctors, they didn't say multiple myeloma. They was like, oh, you must be looking for some pills, some prescriptions. And I'm like, no, I'm not looking for any of that. I'm trying to figure out why am I so tired, and why is my back off the chain with, like I can't even function. And so, Rich, and I know you had tremendous, like you said, you had the same similar situation with the spine issues. I don't know what type of pain you guys in, because I was in pain, but I certainly didn't have, my spine didn't collapse. I didn't have those type of lesions. All mine were mostly on my rib cage in the lower portion here. And so I think the disease itself was just causing me to have a lot of back pain. When you get to the space of understanding, like, okay, I have this disease, I'm in the process of treating it, what is your mental state like at that time frame?
So I got to back up for a second to say that before I was diagnosed, I was in so much pain, I did not want to live.
Oh, that's heavy.
I mean, I was in so much pain, and I can remember nights and I'm laying in bed and there was nothing I could do to make the pain go away. And it was basically because the previous injuries that I had on top of the spinal lesions was causing like compression on the nerves in my upper spine. And that's what drove me to the pain clinic. And I have to say what's important about this and why delayed diagnosis. Myeloma is an insidious, evil disease.
Yes, it is.
It really is. And part of the whole delayed diagnosis thing is that a lot of crazy things happen. Like one of the things that you mentioned, Chad, so and I thought about this, so I'm in pain. I'm gonna go to a chiropractor. Literally, if you have multiple myeloma and you have spinal lesions,
that's the last place you need.
There you go. That's the last thing you want to do. Yeah. But I'm gonna tell you the other part. So here's the other insidious part. So say you have kidney issues, right? So I had kidney issues. I'm in a world of pain. Right? So, and I can remember going to the pain clinic and, and I'm telling them I'm in pain, I cannot get out of pain. And I said, I'm taking ibuprofen, not enough to cause any liver damage, not knowing that I had kidney issues, right? And again—
You're worried about your liver.
Right, I'm worried about my liver, not knowing that I have kidney issues. They don't even know that I have kidney issues, right? And literally, so now if you get prescribed certain things like NSAIDs and you've got kidney issues, that's like throwing fuel on the fire.
Right.
And so literally, where you have a situation where you're already at some stage of kidney failure, you can accelerate that. And so, I think that's an important part to sort of bring up. But I will say that I had, once they figured out what was wrong with me. You're in acute kidney failure and you had this ridiculous level of myeloma. It's 3 days I'm circling the drain. They're trying to get my kidneys restarted. I've got literally 3 bags of fluid and they pump 12 pounds, 13 pounds of fluid just to get my kidneys restarted.
Right.
They did that and then they gave me a monoclonal antibody. And I remember thinking when they explained to me, you're at 43,000 and you need to be down, I couldn't even see where I needed to be healthy. I could not see it. And I'm telling you, I thought to myself, I don't think I'm gonna make it. I really did. And
that's the part I was trying to get to is what was your mental state? And all that's important, because you're going through a lot at that particular time frame. And I don't want to just sit here and assume what your mental state was, but to me, that is the space that you get to when you're in a situation like that. You don't really want to be here anymore. And I recognize how people couldn't. But now I understand how people can get to a space where they be like, hey, enough's enough, especially when you're dealing with a chronic pain.
Yeah.
And so, Chad, when obviously you weren't the one who had the cancer, but what was your mental state once y'all found out, hey, this is multiple myeloma, oh my God, my wife's back is broken?
That was the main concern at the time, just because we had to deal with the specialist and the surgeon to stabilize her back. So that was the first major surgery that she had to undergo. So
Before we even addressed the myeloma.
yeah, before there was a bone, I think that was even before she had the bone marrow biopsy done. Like, no, it was not before she had the bone marrow biopsy done. Incorrect.
I love it. Y'all don't see it, but his wife's in here. She like, but understand.
I mean, but it was right there. Like that was the number one thing. We had to stabilize her back. So, and that took a lot of extra care. Like because the wounds had to be drained on her back, and pain medicine had to be administered. Like, she had to get enough pain medicine, but not too much pain medicine. So,
but where are you at though? That's what I'm saying. Like, where are you at mentally when all this is going down?
I'm thinking, I can't fix this, but I'm gonna do everything I can so that it doesn't kill her.
Yeah. You get me a little emotional here. I could feel you though.
Like, he was just like, I mean, everybody always throws out that 5-year number, and like one of the first things they said to me was, your wife has a 5-year survival rate of 30%. And I was like,
right.
Fudge, man. I'm like 42.
Right.
Like that's not even, like, my daughter's not even graduated from high school.
Right.
So like I can't have those conversations.
Yeah.
So I mean, so there was definitely a lot of fear and of the unknown, but at the same time, I know my rock wrapped in leather.
That part.
If 30% of the people live 5 years, she's gonna live 50 years.
Right.
So I always knew that. So I guess I always had that to fall back on. I always know my wife is 1 in a million. She's 1 in a billion. Like, we go to a store, she sees stuff. She always wants, the most expensive, rarest thing. Like, that's just what she is.
That sounds like a lot of women, to be honest.
She's always the special case, no matter what.
Right.
So
that's dope.
Good, bad, indifferent. That's what it is.
So, ultimately, wow, that got me a little bit emotional too. It's important to understand when you're in a situation when you're facing a life or death situation. It's important to understand where you're at mentally and all that. It's important for when you have this disease, as you said in the beginning, don't try to be your own doctor. If you think there's something wrong, go do something about it. For men in general, hey dog, gotta stop letting the ER be our primary care physician. We really got to cut that out, especially black and brown, but men in general. But we got to cut that out. We got to respect our care partners, and I thank you for coming on the show with us. I know it got a little emotional, which is fine. She deserves that. I know her personally, so that's dope. I know it got a little emotional with you too, Rich. And just so you understand that multiple myeloma is a disease that is incurable, but is extremely treatable. You heard just 3 different versions of it, and I think your wife is in year what?
5.
She's in year 5, so to hell with that 5-year theory. I'm in year 7.5, so heck with that 5-year theory. And Rich, you're coming up on your 5.
I'm coming up on 5, yeah.
And there's people that have 15, 20, 25 years of living, or the disease living with them, because it's a situation where you're still in control.
Hey, can I say something really quickly?
Sure, man. I'm going to close it out and we go.
I got to say, Chad, I commend you. Before I was a patient, I was a caregiver. I had a partner who had breast cancer. And literally, it was 4 years, and it was tough. And I have to say that, I was speaking to a doctor, and he said, sometimes, and myeloma doctor, and he says, sometimes the patients come in and the caregivers look worse than the patients, because it is really, it's a really, really hard job. And because it's out of your control. Being a caregiver is out of your control. And you can't feel what the patient feels. And so it's very difficult mentally. Sometimes it's very difficult physically. I'm sure taking care of your wife was just, so I commend you. I thank you for being a caregiver, because I know what that's like. And I thank all of the caregivers out there, because it is immensely difficult. You care for someone and the circumstances are just out of your control. That is a hard, hard piece.
Well, listen, we're going to close out on that.
I can say something now.
Oh,
I can say one thing, just real quick. Like, I got to say that the patients in the multiple myeloma community are the most amazing people that I've met in my entire life.
Wow.
Hands down, I've been around some very extraordinary people prior to being introduced to this gang. This gang,
squad, whatever.
And the stories of survival and thriving is just amazing. And I feel honored to know you guys and to know everybody in the multiple myeloma community.
And this is coming from a Marine.
Yeah.
So that's saying something.
All right, we ain't gonna make love up here all night, okay? All right, we're gonna love on each other, but we ain't gonna make love all night. Listen, I'm really excited that you guys have joined me. Chad, Rich, thanks for joining the show. I'd like to ask one last question before I let my guests leave. When you wanna get psyched up, geeked up, pumped up, hyped up, and every other kind of up, give me one hip hop song. I'm gonna start with you, Rich.
So I'm gonna give you two. So White Line, and then there's a tune that is not quite hip hop, but it's called "This Is the Life" by Living Color. Gotta listen to that tune. The words are amazing.
That's true. I gave you that one. Okay, I gave you that one. Because I was wondering where you was going. I thought you were going to say something like some Harry Belafonte. I'm like, no, that ain't even close to rap.
But it was relevant, right?
Chad.
I'm gonna go with Poppin' My 3-6 Mafia.
Ooh. Listen. That's a tough one. See, y'all thought, don't let the package fool you, gangster. So listen, I really appreciate everyone joining us on this episode. I'd like to thank our sponsors, Johnson & Johnson and Pfizer. You can always get more information at that'smyword.mm.com, mmtoldtrue.com. And of course, you got Blood Cancer United, International Myeloma Foundation, and I think I got it covered. There's plenty of other resources out there, but those are the ones I would suggest you start off with. So as I like to always say, peace out. Oh, I forgot, that's the wrong thing. Peace out, keep 50 guessing.